let's start with, how did you become a doctor? What made you want to be a doctor?
Oh, when I was little, I was really interested in science, and then I also liked to work with my hands a lot. You know, I was one of those kids who always took things apart and worked on my car. I owned a stethoscope to balance the carburetors in my old MG before I ever had one to practice medicine. When I got to college, I really liked science, and as I got more and more involved in science, medicine just seemed to be natural for me. It was a fascinating thing to do. I thought I could do it well, and then when I got into med school, surgery was certainly something that helped me really use my hands and make me feel like I was getting something done. It was one of those things where it kind of fell together on its own.
Okay, so you just kind of gravitated in that direction.
I did.
Tell me where you went to school and got your undergrad and med degrees.
I went to undergrad school. I went to Ohio State, and then I stayed there for my medical school. Came down here to Vanderbilt. I was going to do a year in training and internship and then go back to Ohio. But I got to Nashville, and Nashville was the nicest place I'd ever lived. And so I've been here for 35 plus years now.
Okay. What did you do once you finished your residency?
I went into practice. I practiced surgery. In Nashville here for 15 years. And my wife got sick, and I had 2 younger kids, and so over a period of 4 years or so, she got more and more ill, and then finally she died. And so I ended up having a family to support, and I couldn't really take the surgery call the way I could before, and so I had to shift gears a little bit. It was an opportunity for me, at least, to try to look at it that way. And I worked for a large hospital company, and then started my own company. So it's given me an opportunity to really see a few things about medicine from several different perspectives, both being the doctor, and also I can see it through the hospital administrator's eyes, and also through an owner and operator of a medical company.
Okay. Talk to me about medicine in Tennessee. Where do you see it right now? Where do you see some of the challenges and some of the great things about the medical community and healthcare here in our state?
Well, of course, with medicine across the country, we see a lot of changes going on right now, and a lot of insecurities as far as what the practice of medicine is going to look like going forward. Specifically here in Tennessee, we're still battling the problems of medical liability reform. For instance, we educate residents and students here in the state of Tennessee, and say if you want to go into gynecology or obstetrics, it doesn't make a lot of sense to stay here and practice once you get out, because the medical liability environment is so poor here. And so we see that as a brain drain kind of on the state of Tennessee. Tennessee has a lot of good things going for it, though, too. I mean, you know, we have a very vibrant medical community. Nashville really is the capital of the for-profit side of healthcare in the whole world, and we have a lot of medical innovation going on in the state of Tennessee.
Okay. It's going to date us if we talk about TennCare and Medicare, because if this lasts for a while on YouTube, we might not want to get specific about that. But generally, with reimbursement cuts and things, what are some of the challenges physicians are facing? We've got overhead going up, reimbursement going down, regulations, and I mean, what does TMA do for doctors in those challenge areas, do you think?
Both in Tennessee and across the country, I mean, that trend of the reimbursement for medical services is going down. And by no means is the cost of running a practice going down. So the margin, the profits that a person makes between what it costs them to do business and what they bring in, that amount is going down. And so we have to figure out ways to help the physician adjust to that. In the rest of industry, in the last 15 or 20 years, even longer, their primary objective is to get a very good control on the cost side of doing business, and that's one of the things that has made our country very good. And so we need to make sure that our physicians are equipped with the tools and the know-how on how to manage their practices in a way that doesn't allow the practice cost to escalate and cut into their income very badly. On the other side, on the reimbursement side, our voice needs to be heard in those institutions that control the amount of reimbursement. And that involves insurance companies, and it involves government primarily. Insurance companies are a big gorilla, and we need to have an effective voice in dealing with them. And that, of course, is one of the primary objectives that TMA needs to fulfill for the physicians. Insurance companies are used to running over doctors in small practices, and we need to figure out a way to stop that. That's one of the things in our survey in the Futures 2 efforts that we've been doing. That one of those things that have bubbled to the top is the thing that the physicians need our help the most with. That, and of course representing them down at the State House and in Washington as far as the reimbursement that comes from the government side.
The advocacy that
Yes.
the TMA does. At every level, I guess. When you talk about the value of TMA for a member, and actually a lot of these values extend to non-members just by way of,
Absolutely.
default. But what are the values of belonging to and being a part of a group like this?
Well, organized medicine is one of those things that we can only be strong if we stand together. It was a fundamental that our country was founded on. The AMA requires us to stand together to be effective in Washington, and the TMA needs everybody here with our statewide efforts. People who don't stand with us still benefit, you're right, but there are a lot of people out there who understand the importance of that. We have overwhelmingly heard our members say that advocacy is the primary reason that we exist, and we take that very seriously. It's about advocacy at the legislature, but then again the insurance companies as well, but those are the two big things. Now, we also try to develop other packages and benefits of things that some of our physicians want, and those are things like help with EMRs and practice management and those sorts of things that will benefit a physician, and we continue to work on developing those programs all the time.
Okay. What do you think about our social media efforts within the TMA that we've just started in on? Do you see that out and about among physicians at all? Are they delving in, and how do you feel about the TMA diving in as well?
Well, this movement towards social networking is something that you can't ignore. Our president, in my opinion, sits in the White House right now because he figured that out. We have to do that in order to stay in touch with our young physicians. But we really just need to do it because it's a way of all of us communicating, and we're a little slower as older adults to catch on to that, but we're getting it. And so putting that in is a piece of the way we communicate within TMA for the physicians who are in the state here is a wise thing to do. I think that that's something that will develop and mature over time, and we'll be happy that that's in place.
Right. Well, for instance, this will be on YouTube at some point.
Absolutely.
And people will be able to watch you and share you and forward you all around. So I hope that message gets out in an electronic way. That would be really great to be able to share your comments.
And again, this was one of the things that we identified at the Futures 2 level over the last couple of years, and we saw early on that the amount of time, effort, and resources that we committed to our communication efforts within TMA were much smaller than we thought they needed to be in order to stay in touch with our physicians and to get feedback from our physicians so that we are pursuing the things that they need and want most in their lives. And so we've spent a lot of time and effort to upgrade our communications, both outward and inward, to see if we couldn't address that. And the social networking and electronic communication is all part of that.
Great.